When I say to people who don't work in healthcare that I'm a body radiologist, they usually are confused. Isn't their body your entire body? But really, it is called body because so much of the pathology that we see is happening in basically our abdomen and our pelvis, which is mostly the areas that I'm looking at. There's lots of general screening that is done that we're seeing, whether it is the occasional chest CT, looking at changes from people who have a history of smoking, and then just so many of the general aches and pains and symptoms that people experience over the course of their life are really happening just right in the core of your body here, and that's what we're focusing on. Time on the multidisciplinary tumor boards is a really important part of cancer treatment, being able to communicate directly with the surgical oncologists and the medical oncologists and even the pathologists, so that everyone's on the same page, just to be able to speak directly with the clinicians about the findings that we're seeing on the imaging and having a good understanding of the clinical progress that the patient is making when certain treatments were initiated or switched over. Knowing that can change the interpretation of the CT, and so that's really why having that line of communication with the oncologists is so important. There have been a lot of cases of diagnosing younger people with cancers, the type of cancers that body imagers like myself look at. In particular, colon and rectal cancers are becoming more common amongst the younger population. It is a good reason to emphasize things like seeing your primary care physician, getting your colonoscopy done as soon as it's recommended, and just being aware and paying attention to your body. We encourage people to seek care sooner rather than later because every little bit of time makes a difference in these types of disease processes. When I think about what brings me the most satisfaction, I think I'm pulled in two directions. One direction is I see a lot of cancer staging studies, so obviously there is satisfaction in just pulling up a scan and seeing that the patient's disease looks much better. Those are satisfying to report, and they're often not very hard to report, to just be able to say, it's better everywhere. The flip side of that coin is, not every study that I'm reading is somebody who has a known diagnosis of cancer or of anything severe. And what is also very satisfying in the day-to-day is when you get somebody who maybe you just incidentally notice something in one of their organs, the pancreas, the liver. Maybe they came in for something minor and you're able to detect something at a very early stage that then is going to result in them getting treatment much sooner than they would have, which means a much better prognosis. So as much as being able to say someone's cancer has improved is satisfying, sometimes finding a small early cancer is even more satisfying.